And I'm really proud to be here at the Sacramento Central Library to announce the introduction of AB 1955. This bill establishes the Healthy Kids, Healthy Minds demonstration project, which will provide funding for nurses, mental health professionals, and extended library hours in schools. This bill implements a pilot program for school districts and individual school sites to receive funding to hire a school nurse, a mental health professional, and to keep libraries open 1 hour before and 3 hours after school. As a former medical consultant to Sacramento City Unified School District, and as a school health physician, I know how important school-based health and learning services are to the success of our students. In fact, as a pediatrician who takes care of children who, many of them who may have challenges with behavior or learning, what we know is that when students go to school and teachers have to try to teach these students, that often students need more support to try to be ready to learn. That there may be things they're bringing from their home environment when they come to school. They may, in order to engage them in the classroom, they may want to be able to explore some areas on their own through the school library. They may have health issues that are distracting them from being able to focus on what the teacher's trying to teach them. We need to provide students with the kind of support that allows them to be able to be ready to learn, to focus on what the teachers are teaching them. We need to provide those supports for the teachers when they identify students who have those problems. In fact, we do have a body of research that shows that these types of services lead to better academic performance, improved attendance, and lower dropout rates. But unfortunately, the reality is that we're not providing these services to students at levels that are needed. So this bill creates the opportunity to provide pilots so we can demonstrate the efficacy of this kind of support in school districts across California. And hopefully then build the public support so that every child can get these supports. And just to give you an idea of where we are right now, in 2012, the ratio of students to these critical support personnel in the state are staggering. We have 2,817 students to every school nurse. And in fact, the federal recommendation in the Healthy People report is 1 to 750. There are 8,137 students for each librarian in schools. For psychologists, 1,429, and for social workers, 14,772. And we certainly know the need is greater than that. I mean, we know that there are probably the percentage of children with mental health needs is probably anywhere from 10 to 20%. And yet, we only have such a small number of people who can help these students. And just to put that into perspective, since we're here in Sacramento, Maine's ratios are more than the average attendance in a Sacramento Kings game. Can you imagine someone trying to take care of a whole stadium full of people and being the only one? AB 1955 will help schools that are lacking pupil support. This bill will provide a supportive environment outside of the classroom so that students can have better opportunities to succeed inside of the classroom.
California's public school students face a crisis that falls hardest on poor and working class communities and communities of color, because many of our schools do not have full-time nurses, mental health professionals, and our school libraries are not open and available for use. California students lose approximately 2 million cumulative days due to asthma-related illnesses that make academic success difficult and result in lost revenue for districts. 250,000 students need eyeglasses, but are not screened because what used to happen in schools, the regular eye exam, no longer takes place. As a parent myself of a child with a severe peanut allergy who carries an EpiPen, my wife and I worried every single day when my daughter was in elementary school, knowing that there was a nurse on campus only one day every few weeks.
I'm concerned that in my 2 children's schools do not have psychologists, a nurse, and a librarian available every day. For example, The nursing sorority school comes twice per month. Twice per month. Do you think that is enough? No, it's not. It's not enough. We need these services for the students. Things happen every day, and a nurse has to be available all the time. That's essential resources, and our children need attention. They need those services, a psychologist, counselor, and to have access to the library after school to do their homework, work, and to read books. These resources are basic tools that they need to succeed. Let's make sure all students have the school that they deserve.